Okay, so here's the deal. Doctors are not all bad, okay? There's some great ones out there, but in this system we have in this country, they're not trained to treat the underlying cause. They're not trained to address the root cause and promote healing. They are trained to prescribe medicine and do surgery. There's a time and a place for medicine and surgery. You know, we've all been there. We need antibiotics sometimes, okay? We need to have an appendix removed, and praise God for medicine and surgery. I am not out to vilify medicine at all. However, if the system has failed you in a way where you are wellness focused and you want to feel better, but you're not sick, you just want to feel better. Oftentimes, so many of my clients, friends, family members, myself, we fall through the cracks of that system because you don't fit a mold, you don't fit a diagnosis code, you don't fit, a pill for this ill. You just don't fit that mold, okay? And you're not wrong for wanting answers and wanting to feel better. Or maybe you have a really good doctor that is, that will follow along with what you're talking about, and they will order the testing does a little deeper dive, but they're just trying to appease you because they want to help you, but they don't really know how. They don't have the tools. So they'll give you this more detailed, in-depth analysis of your blood work, but they don't know what to do with it. So medicine in general just has big, big ranges of normal. So vitamin D, B12, TSH, ferritin, iron. So all of these things have huge ranges, right? And like vitamin D, for example, 30 to 100. 29 is like clinically deficient, all right? 101, you could be having spasmodic episodes and like need to be hospitalized. So that range is not necessarily where you need to be optimally, okay? So optimal vitamin D is between like 60 and 80 is what we strive for. But again, it's case by case. So what I'm trying to say is, even if you get functional leaning tests from a traditional doctor, they may not know how to appropriately optimize everything that they see on the paper because they're just not trained that way. They're not trained for prevention or longevity, anything like that, anything that you're seeking. Sometimes there's, a needle in a haystack and you find that practitioner and that's like gold and your insurance covers it and everything. But oftentimes that's why functional medicine, providers, we don't fit in this mold of the system. So insurance doesn't acknowledge us because the system is to help manage the sick, not to promote wellness. So outside of the system, that's why there's this cost. Anyway, that's a whole other soapbox. But basically what we're doing is getting your blood work and optimizing your nutrients. Here's a example I see all the time. Clients have hair that's falling out. That can be from so many different reasons. A lot of times doctors just chalk it up to aging. You're getting older. That's what happens when your hair falls out. Try a different shampoo. Try washing your hair less. Okay. If I hear hair is falling out, it can be one of three things usually. It's usually high testosterone, and PCOS patients are very aware of this. High testosterone can cause scalp hair loss. Okay, it can also be low ferritin. Ferritin is your iron-carrying protein. It helps keep your hair follicles attached to your scalp. Low ferritin will cause scalp hair loss. Also, it can be a thyroid issue, and the endocrinologists know this one well. But if you're hypothyroid, that can cause scalp hair loss. All right. So it can be a combination of those things or one and not the other two. So again, there's no one size fits all Band-Aid treatment for hair loss when you're coming at it from a functional perspective. So what am I saying? Conventional testing isn't wrong. It just doesn't do the deep dive. It doesn't address the root cause of your symptoms. So that's what I like to do. I love the patients who come to me who have done all the research, who have so many symptoms. They've Googled, they've asked ChatGPT, they've just asked the world ask their OBGYN, ask their internist, ask their neighbor, and they're just not getting, they're overwhelmed with information, don't know which direction to go. That's my favorite patient. So if that's you, you're in the right place. Let's get started. Let's get you feeling better, but let's figure out what to do with where you are. Let's get a baseline of your hormones, your gut, your micronutrients, and figure out what's going on so we can put you on a path to healing.